Autopsy reveals drug reaction as possible cause of Mohbad's demise. Hello everyone, you're so much welcome. Now let's cut to the chase. The samples from Mohbad's gastric contents, blood, bones, marrow, liver, kidney and lungs were taken for toxicology testing. As we heard just a few minutes ago, the anatomical and pathological findings included an injury on his right forearm and moderate to severe position of the body. According to the report, no significant gross findings were attributed to the cause of his demise. Toxicology revealed the presence of diphenhydramine, an antihistamine, in a non-fatal concentration. The autopsy could not determine a definitive cause of Kpaied, but considered a possible drug reaction due to the absence of significant post-mortem and toxicology findings. The report noted that the body was never autopsied nor embalmed before burial, which happened on the second day after his demise. Now, according to the report brought by the Kpaied, and which had the stamped signage of certified true copy, I'm going to take a read for a lot of us who are cerebrally inclined or who want to know more about it or who are not in the line of the medical sciences. We could just, have to know one or two things about all these things. It says post-mortem report on Aloba Promise Oladimeji Erioluwa. That's the name of the deceased, and date of birth 3/1/1997. Age at Kpaied, 26 years. Sex female. Occupation musician. Address 3 Powerline Okeletu, Ijede, Lagos State. Hospital number not applicable. Place of Kpaied, Lekki. Time and date of Kpaied 3:30 p.m. on 12th September 2023. That's 12/09/2023. Place of autopsy, Lasut Autopsy Room. Time and date of autopsy, 1600 hours, that's 1600 hours to 1900 hours on 21/9/2023. Autopsy number C273/23. Authorization coroner. Cause of Kpaied unascertained. Pathologist Professor S.S. Shoyemi and Dr. D.A. Sani. Report signed on 29th April 2024. Now I'm going to take a little reading. Introduction. Aloba Promise Oladimeji Erioluwa, a 26 years old musician, reportedly Kpaied on the 12th of September 2023, and he was said to have sustained an injury on the back of his right forearm and had an injection by a supposed nurse. He was noticed to have developed sudden onset of convulsion and Kpaied in transit to the hospital. His body was initially buried on the 13th day of September 2023. However, it was exhumed on the 21st day of September 2023 for a post-mortem examination following the order for examination. Declaration. Shoyemi, a consultant pathologist, hereby certify on soul and conscience as follows. On the instructions of the coroner, I performed a post-mortem examination on the body of one Aloba Promise Oladimeji Erioluwa at the Lasut Morgue on the 21st of September 2023, commencing at 1600 hours, and it has persons in attendance: Dr. D.A. Sani, that's consultant pathologist; Dr. E.F. Emiogun, consultant pathologist; Dr. A.I. Mbehoma, consultant pathologist, all from Lasut, and also Dr. O.O. Onoyemi, senior registrar, Lasut. Police officers from State CID, Panti, Lagos, led by CSP Chris Onyeisi. Identification of the corpse. The body is identified by Aloba Blessing, that's elder sister to the deceased. Clothing. The body is covered with an off-white shroud. The body is dressed in an off-white long-sleeve shirt and white matching pant, a white pair of socks, a white pair of gloves, and a white cap. External examinations. The body is that of a dark complexioned adult male with physical appearances consistent with the stated age. The height is 1.96. The head hair is black in color and braided with a maximum length of 21.0 centimeters, saying that irun wà lórí Mohbad, irun dúdú, wọ́n dẹ̀ braid ẹ̀ pẹ̀lú length of 21.0 centimeters. So níbo ni news pé wọ́n fa orí pàfà kan fa orí Mohbad ti wá? Let's continue. The eyes are molaized, the face is bearded, the ears have been pierced once for jewelry, and the mouth contains a set of natural teeth in good state of repair. The fingernails are short, clean, and well kept. There is no identifiable nicotine staining of the fingers. The body is circumcised. The toenails are also short, clean, and well kept. There is no ankle oedema. No external evidence of significant natural disease is observed. There is wrinkling of the skin of both feet. The thoracic and abdominal sota, carotides, venae cavae, pulmonary veins and arteries, and the renal arteries are unremarkable. No thromboemboli are observed. Now to the respiratory system. You can see the way they are putting it in sequence. Respiratory system, the cartilages and hyoid bones are uninjured. Further exploration of the neck shows no soft tissue and skeletal injuries. The trachea, windpipe, and the rest of the bronchial tree are unobstructed and free from disease. The pleural surfaces are smooth, there are no adhesions, and there is no fluid collection in the pleural spaces. The left and right lungs weigh 350 gram and 400 gram respectively, and they have a flabby consistency. Cut surfaces of the lungs show congested appearance. Beads from the upper and lower lobes of both lungs sink in water. Some degree of atracosis, carbon deposition, is present. Digestive system. The mouth, tongue, teeth, and esophagus are unremarkable. The peritonial cavity contains no excess fluid and there are no adhesions. The stomach has a healthy mucosa and wall. It contains approximately 5 ml of brownish fluid. There are no areas of corrosion or secretion or perforation. The duodenum, jejunum, the bowel contents are normal and there is no bleeding. The appendix is present and unremarkable. The rectum and anus are essentially normal. The liver weighs 850 grams. It has a smooth reddish brown surface and a flabby consistency. Serial sections are unremarkable. The gallbladder empties readily into the duodenum. It contains clear bile and no gallstones are present. It has a wall thickness of 0.1 centimeter and a greenish yellow mucosa with a honeycomb appearance, and the pancreas weighs 50 grams. It is 25.0 centimeter long with external diameter varying from 2.0 centimeter at the tail to 4.0 centimeter at the head. It has a yellowish lobulated surface with a rubbery consistency. Cut surface is unremarkable and the pancreatic duct is unobstructed. Atide genital, that's the urinary system, listen. The renal capsules strip casually or easily, revealing brownish subcapsular surfaces. The left and right kidneys each weigh 150 grams respectively. Sections show a cortical thickness of varying from 0.6 to 0.9 centimeter. The pelvis and ureters are unremarkable. The urinary bladder has a wall thickness of 0.3 centimeters and contains no urine. The prostate gland is unremarkable. Both testes are present in the scrotum and are of normal size and shape. The external genitalia is unremarkable. The lymphatic system. The tonsils are unremarkable. The spleen weighs 50 grams. It has a grey, smooth capsule and a rubbery consistency. Cut surface shows a dark red wet appearance. The thymus is unidentifiable. And the cervical, mediastinal, mesenteric, para-aortic, and other peripheral lymph nodes where exposed are unremarkable. The parathyroid are unremarkable. The thyroid gland and adrenal glands are essentially normal. The pituitary gland is unremarkable. Long details. Let's go to the cranium and nervous system. The scalp and skull are unremarkable. The meninges, brain coverings are unremarkable. There is no epidural, subdural, or subarachnoid hemorrhage. The brain weighs 1,200 grams. It is autolyzed into a grey paste-like material. Musculoskeletal system. Skeletal system, not today. One is the spiral column, limb girdles, long limb bones, hands and feet, ribs and sternums are unremarkable, visible, or on palpation. The muscles were exposed during routine dissection are unremarkable. Samples retained for histology. HCAT. I think it's heart, but they wrote HCART. The second one is lungs. The third, liver. Fourth, spleen. 5, adrenal. 6, pancreas. 7, kidneys. In the light of the foregoing, cause of Kpaied could not be ascertained. However, the possibility of a fatal anaphylactic shock drug reaction could be considered in view of the absence of any significant postmortem and toxicology findings. And this is a report that you can Google online from the cable that decided to publish it just a few hours ago. So, in summary, once a week, reaction drugs and the possibility fatal anaphylactic shock ni wọ́n lè consider pé ó fà lọ́n rí nínú postmortem tó ti ṣe. So, ẹ gbé yẹ̀wò, a máa ṣe analysis ẹ̀ ní next video.